What if the power to shape health and well-being came not from systems or institutions, but from people and communities? Not from policy, but from participation, from relationships, from resilience? In 1992, in a hospital cafeteria in Edmonton, a question turned into a movement. A 30-year journey rooted in building trust, nurtured by resilience, and grown through community-led change. A small group of changemakers challenged a top-down system, and the Edmonton Healthcare Citizenship Society, EHCS, was born. That movement has evolved to become Action for Healthy Communities. The 1990s were marked by cuts. Alberta's health reforms slashed public spending, and hospital closures left many behind. Community groups scrambled to respond to the growing social impact of government retrenchment. In 1992, amid rising poverty, refugee waves, and gentrification in inner-city Edmonton, AHC was born out of frustration and vision. Its founders believed that communities should define their own health, not wait for top-down policy. A bottom-up approach, residents know best. AHC took its first steps, registering as a society in 1995, then became a registered charity by 1998. With seed grants and mutual trust, Somali communities, Southeast Asian youth, and inner-city neighbors launched their own solutions: community kitchens, safety walks, and tenant rights advocacy. With modest seed grants and big ambition, Edmonton's inner-city residents mobilized their communities. While Alberta slashed health spending and services regionalized, AHC chose another path: solidarity. Through the 2000s, AHC had moved from vision to structure. A new leadership team professionalized operations while still centering community voice, hiring more staff and forming its first office. Leadership and community animator training programs emerged. Forums like the Voices from Our Neighborhoods project trained over 20+ community animators, turning local knowledge into organized action. Seniors, immigrants, families, all had a platform to act. AHC held on to what made it powerful: a people-first approach. AHC became a mirror for the community's strengths and struggles, all while Alberta's public health agenda shifted toward chronic disease prevention. As AHC matured in the 2010s, it evolved into a recognized force in civic integration and community development, extending programs into schools across all school boards, libraries, and community centers. It became a hub for newcomers' economic, social, and educational integration. While some organizations distanced themselves from community organizing, AHC embraced it, remaining community grounded, mobilizing newcomer youth, developing peer facilitators, and addressing the stigma around mental health. Adult literacy, employment, entrepreneurship, innovation, and settlement services brought new faces and new energy to AHC. But the participatory model remained. Residents were still at the center of every solution. From cultural fairs to policy forums, AHC translated lived experience into systemic change. When COVID-19 hit, existing inequities exploded. Racialized families, refugee households, and low-income workers bore the brunt of the crisis. AHC didn't pause. It answered and expanded. Launching the Edmonton COVID-19 Rapid Response Collaborative, AHC coordinated with 12 agencies. A $3 million rapid response initiative serving thousands with food, PPE, financial support, access to vaccines, and culturally relevant mental health care. It expanded to rural Alberta, launched supports for displaced Syrians, Ukrainians, and Afghans, and pioneered virtual engagement models, bridging the digital divide with virtual programs in multiple languages. Behind it all, the unshakable belief that communities hold the answers to their own well-being. And through it all, the heart stayed the same. Meet people where they are and build with them, not for them. AHC stayed true, building capacity through crisis while elevating agency. Today, AHC sits at many tables: policy, funding, research, but never forgets its roots. With programs in over 30 sites, rural Alberta outreach, and regional pilots in mental health and financial empowerment, AHC has become both a trusted partner and a people's movement. 30 years on, AHC still builds from relationships, not transactions, from community, not control. As we move toward the vision of expanding into new provinces and national conversations, we recommit equity, co-creation, and enduring trust are our compass, from the grassroots to a seat at the table and beyond. "30 years ago, AHC began with a simple belief. Communities have the wisdom they need. That belief is now a legacy, and yet it's also a beginning. As we look to new provinces, new partnerships, and new possibilities, our roots keep us grounded and our people keep us growing. From grassroots organizing to national influence, AHC has never lost its founding mandate: to build capacity, amplify voices, and center relationships. As it envisions growth beyond Alberta, AHC carries forward the wisdom of 3 decades, that health, well-being, belonging, and change all start at the grassroots.